Hi, my name is Dr Pete Chamberlain. I'm a GP in South Sefton. Just like to reassure you that our practices are open. This video helps explain what happens in a normal general practice day and some of the things that general practices have sought to change and develop to increase the ability to manage more patient care during this challenging period. So we open up the practice about 7:45 and as a GP I start at 8, log on, and I try and shift a few urgent prescriptions that need to get to the chemist before we basically move to surgery at 8:30. Some patients have fed back. It's been challenging to get an appointment recently due to the huge increase in demand. Now there's a number of reasons for that. There is the increase in long-term conditions and complexity of care that we're experiencing in the population. There's the pandemic backlog, which is all going through general practice, and we know the hospitals are under huge pressure. GPs are obviously involved in carrying that, and we're also seeing a huge increase in viral illnesses. So what are we doing in general practice to try and manage this? Practices have been adopting new roles such as advanced nurses, pharmacists and physiotherapists to ensure that patients get seen by the most appropriate clinician. Most GP practices use some form of a triage system. This means that when a patient calls our practice, they'll be asked some questions by the receptionist first to help us understand the patient's healthcare needs before being offered an appointment with a clinician. This means that we can offer patients the best type of appointment with the most appropriate clinician for their specific needs. Now, there are different types of appointments. These include face-to-face, obviously, telephone, but also video, and now digital consultation or Econsults. The types of appointments enable practices to manage a higher degree of demand. For instance, 2 telephone consultations generally can be managed in the same time as a face-to-face appointment, and 3 digital e-consults can be managed in the same time as a face-to-face. This means that practices can actually manage more patients and ensure they get the care they need, but it does mean that there's less face-to-face appointment types. However, it's very important that patients know that if they need to be seen face-to-face for clinical reasons, they should be seen face-to-face. Safety measures are still in place in healthcare settings, so it's important for patients to wear a mask. We're still seeing patients who may have possible COVID or other conditions, and therefore we're taking extra precautions to ensure staff and patient safety. So it's 12:30 and it's time for clinical supervision with our GP trainee. Many practices have junior doctors, nurses and other staff to train. So it's 1 o'clock and time to engage with some home visits, which is all about managing housebound patients. And today we've managed a patient with acute confusion, a palliative patient who needed care planning, a patient who was short of breath, and a patient who's been recently discharged from hospital. Managing the patient workload in the whole as we do creates space for us to get out and see the people who need seeing in their own homes who are vulnerable. Okay, it's 3:30 and it's time for some e-consults. E-consults allow patients to submit their queries to the doctor online and helps by asking some specific questions. They're very good for things like routine requests where the patients know what they need, and also if there's a visual problem that you can take a picture of. They're not great for things like urgent requests where we'd advise patients to contact the practice directly via telephone. So it's 4 p.m. and time for evening surgery, and some of the patients that I've triaged earlier because I'm on call today are being brought in for examination and further review. So this is the end of patient appointments for me for today. So it's 6:30 and the practice door is now closed, but as a GP, this is when I start my admin. We've got a variety of things to get through, including medication queries, of which there's about 50. We've got labs, of which there's about 60 today. We've also got documents that we have to review from the hospital, which will include things like tasks, medication changes, and there's about another 25 of those. So it's 8 o'clock and we've got through most of the admin. So it's time to basically call it a day, lock up the building and get home. But even then, a lot of GPs will take a remote laptop home to finish off a few tasks and ensure they can close the day with peace of mind. So I hope you've enjoyed the day together with me and learned something about how general practices are seeking to manage the increase in demand across South Sefton. Thank you for continuing to be patient and kind with our staff as they seek to help you. GP practices are working hard on your behalf. Thank you very much.